chief guest for this program, Mr. Shankar, Director Customer Care, Philips Healthcare India Limited, Dr. Anburajan, Professor and Head of the Department, Biomedical Engineering, Organizing Secretaries for Bayantra 13, the speakers who have agreed to come over here and deliver their talk. In particular, I happened to meet two of the speakers this morning, Dr. Bhuvaneshwar, Director Innovations and Education, Remitron, Mr. Ganesh from Sahanand Medical Technologies Private Limited, other speakers, participants for this Bayantra 13, and my dear students. It's really a pleasure for me to be associated with the inaugural function of Bayantra 13. It's always a pleasure to be part of such programs and meet people, understand what they are doing, and then we look back and see what we can do to them for a mutual coexistence and then cooperation and collaboration, which is very much essential in today's life. Gone are the days where we feel that as an individual you can achieve anything, but it is not so. You need to cooperate and collaborate. I am extremely happy to see the way in which this program has been charted out. There are 10 plenary sessions and the department has invited experts from different areas. That's one of the first thing that has attracted me. The second thing is the number of participants who was registered for this Bayantra. I was told there are close to 150 participants, and it is a heterogeneous group. Normally there will be a concentration of more faculty members or more students and almost no participants from industry. But today I happen to know that there are about 30 biomedical engineers from Tamil Nadu government hospitals who have shown their willingness to attend this Bayantra 13 and to get benefited from the talk that has been delivered during these 2 days. There are 10 faculty members, at least a couple of them are from states like Andhra Pradesh, Maharashtra, Kashmir and Kerala. And then when we talk about collaborative work, though we call it as biomedical engineering, engineers work differently and doctors work differently. But I am happy to hear that 2 dentists and 2 medical doctors have registered for this conference. So this is a beginning where we can look for a better collaborative work. So in this count, I feel that it is well organized and really it will be useful for all the delegates as well as for our own students. Now coming to this Department of Biomedical Engineering, it is one of the vibrant departments of this university. In order to improve the industry-institute interaction, this department has connections with close to 40 industries where people from industry come over here, talk to our faculty, talk to our students, go through our curriculum, advise us how to reduce the gap between industry and institute. The second thing is they have shown interest in taking some of our students for internship and some of them got placed in companies too. Now as an additional thing that I would like to put forth here is the SRM Ministry is also willing to depute our faculty to go there to the industry, stay there for 2 or 3 weeks, learn what is there, come back, share your experience with the students here. So if any of the industries are willing to accommodate such faculty members, we will be very happy to send them to the industry so that they come back with their experience and then deliver goods in a proper manner. Now we all know that electronics rules us in the form of gadgets or in the form of devices. Gone are the days where we have been using more of our brain to store information. Now everything is with the gadgets. And I am sure Many of us cannot remember at least about 10 or 15 mobile numbers or any phone number, and every time you need to search, then you take your mobile phone, and there are occasions where you forget the name of the person but still try to figure out who is the person and so on and so forth. And number two, imagine a situation where if the battery is down for a mobile phone, then obviously you are not in a position to contact. The information that are available about 2 or 3 decades is much less when compared to these days, and this is because of the internet. So there is knowledge explosion. Though these devices are meant to help us, but we have become slaves of these devices. Now coming to healthcare, since we have devices to take care of our regular activity, we don't move from one place to another. If at all you move, you take some car or whatsoever and less of physical activity. We feel that we are doing some productive work, but at the cost of our health, and that is very important. We are very happy that there is a lot of technological advancement, but there is also equal concern where the number of diseases have increased. Number of people going to hospitals are on the increase. Newer diseases happen to be diagnosed. So these are some of the challenges, but still we want to have some electronic gadgets or devices that will be very easy for us to diagnose, or maybe for the doctors to diagnose, then arrive at a conclusion so that treatment can be started immediately. So I was just going through some of the informations in the biomedical engineering domain, and I would say that 3 things have attracted me. One, the cure for the cancer. Number 2, the number of deaths due to suicide. Number 3, whether we'll be having these pharmaceuticals or it is going to be termed as electroceuticals in the years to come. Then what will happen to all these pharmaceutical companies? And lastly, about the sensors. For each and everything we want a sensor. Right. Now the first thing is cancer. We have been hearing about a lot of patients affected by this cancer, and if it is not cured in time, then it is disastrous. The biggest concern is we don't get symptoms immediately. Now, the statistics shows that about 7.6 million people across the globe die due to cancer. 7.6 million people. It's a great concern. So what is that? The normal thing is it's a diagnosis, then it is extraction, and then it is the surgery, the treatment. It's a normal process, and that can be done by surgery, or radiation, radiotherapy, or chemotherapy. These are common things that are normally done. But the worry is, if that is not done properly, if there is some leftover of these cancer cells, it is bound to come up again, and then it will lead to disasters. Now, if you can completely remove the damaged cells or the tissues, then there is every hope that we can look for a 100% cure. There are 2 catchy words that rule us today. One we call it as smart, then we call it as intelligent. How many of you do not have a smartphone? How many of you do not have a smartphone? Almost everyone has a smartphone. Either you call it as a smartphone or an intelligent phone, whatever you call it. Why you call it as intelligent? Certain things we are not able to remember. We seek the help of that device and then we retrieve that. But to retrieve that, we need to give some input. So that is the duty of our brain. and all other things they take care. And somehow or other, the letter I has got us very much. iMac, then iPhone, iPod, iPad. Now what is, I was also wondering, what is this I? Is it intelligence or innovation? I couldn't get an answer, but somewhere or other, there was some mention that I represents internet for iMac. After that, the letter I got prefixed to all those gadgets that has come out of Apple. And in some of the other blogs, they have said it is innovation, it is intelligent, innovative, interactive, but still we do not know. I happened to come across a device called iKnife. How many of you have heard about this iKnife? Good. It's all, thank you. It's all available in the internet. I have not done anything new, just to look around and see, which is fascinating. Now, chemists from Imperial College of London have come out with iKnife, which gives the pathology lab in surgeon's hands. That means, after extraction, you do not send it to the laboratory, wait for days together to get the result, and then inform the patient. Everything is fast today, fast food and express, no ordinary. Because we don't have patience, that's the main problem. So, even in surgery, we are not prepared to wait. We want to get immediate result. We don't want to sit there for hours together in the clinic and wait for 2 days to get the report and so on and so forth. So these chemists, they have come out with what is called as an iKnife. While the knife cuts the flesh, smoke emanates, which is channeled to a mass spectrometer for analysis immediately. So when the smoke comes out, it is channeled to a mass spectrometer where analysis is being carried out. And within about 9 to 10 seconds, the results are sent back to the iKnife and that is displayed to the surgeon. So what is it? Can we call it as innovative or intelligent? That I leave it to you. iKnife or whatever it is. It also conveys, it gives the chemistry of the biological tissues. It gives the chemistry of biology. And it doesn't stop with that. It also says whether it is a secondary growth and from where it has emanated. It will identify the different tissues too. This has been tested and validated for 3,000 samples in 300 cancer surgeries, and it has yielded good result. That means in the years to come, all surgeons will be having iKnife and the results will be immediate. And now they are also planning for some display. That display will have 3 LEDs having different colors. If it shows green color, that means your tissue is perfect. There is no cancer infected in that. If it shows red, yes, you need to remove that. If it shows yellow, it is neither this way or not the other way. Or at any time can become carcinogenic. So this is one of the latest development that has taken place in the field of biomedical. Then the next one is, which is causing a lot of worry to us, is the suicide. This is totally different. It is not a disease. Or probably sometimes we may also call that this is also another disease. And every time when the university or an institution announces some results of the examination, we find that at least a couple of students commit suicide for not scoring good marks or not clearing papers and so on and so forth. Again, it's a great concern. The statistic shows that about 1 million people commit suicide every year across the globe. About 1 million people. That is the statistics. A simple blood test that looks for enhanced expression of a few genes to accurately identify people who are at great risk of committing suicide. So with a simple blood test, we can be in a position to identify whether an individual is more prone to have this suicide. People planning to commit suicide does not share things with others. That's obvious. Now the question is, how do you know that who is going to commit suicide, where to take him and all, because he doesn't share anything. Now what they have done is, Dr. Alexander from Indiana University School of Medicine has found enhanced expression of 4 genes that can indicate person's inclination to commit suicide. 75 bipolar individuals were studied to find the genomic biomarkers using blood samples. Prior to drawing blood samples at 3 to 6 months interval, the subjects completed a questionnaire wherein they revealed their state of mind, that is suicidal ideation. So exactly we cannot consider this as a disease, but it is fast catching up because we feel that it is, we feel stressed every day and we are not able to meet our deadlines. Then the third one is future of pharmaceuticals. British drug maker GSK believes that the next big wave in medicine will be electroceuticals, technology that uses electrical impulses rather than the chemical or biological molecules found in today's pharma to treat diseases. So pharmaceutical is going to be replaced by electroceutical. And this idea has come out from, not from any other thing, but become a giant who is a giant in pharmaceuticals. Connecting thousands of tightly packed individual nerve cells with electrodes and associate circuitry to read and interpret the code in the collection of nerve cell fibers that constitute a nerve, and then modulating the code to restore a specific function to a healthy state. And that is the strategy. So we need to identify what are the signals that are sent from one nerve to the other, whether the signals are perfect, it is one and the same over a period of time, or whether there is any change. If you can decode that, then the signal has to be altered, you introduce another signal so that it is cued. So it shows that biomedical engineering graduates have a lot of opportunity to do research. And I am sure health is a great concern for each and every one of us. And there is always a demand for quick diagnosis and quick treatment. Like fast food and other things, we also don't want to wait before a doctor. If you go to a doctor for maybe a simple cough or cold, we don't go, but if at all we go, and if the doctor advises that nothing to worry, take rest, you'll be all right within a week, then next time we will not go to the doctor, because the doctor has not prescribed any medicine to us. Some of the doctors say that psychologically we should be all right. Don't worry about it. Little above the normal level. Do not worry. Get along with regular activity. We will not be satisfied. Or there may be some doctors who give medicines with the lower, they will start with the lower dosage and then slowly move on. And some of them may give a heavy dosage where our illness gets cured within hours. Then we are very happy with the doctor and say that yeah, he is an excellent person. So we do not know what are the complications after that. So as a biomedical engineer, you have a lot of opportunities and challenges ahead of you. Make use of these things. Interact with people from industry. Interact with people from the government hospitals. Interact with doctors. We have a medical college here. At least you should go there, talk to some students pursuing their MBBS or PG program. Talk to them, find out what is the requirement. Come back to the lab, do something here, go back, discuss with them, or call them to your lab and do such activities. It's a wonderful place to look into such research and development. So with this information. I congratulate the Department of Biomedical Engineering for coming out with such an excellent program where the stalwarts from industries are invited to deliver lectures on different emerging areas of biomedical. Thank you and wish you all the best.
Thank you, sir. We are really honored to have so many biomedical engineers and students related to this field here. We would definitely keep in mind the idea of collaborate and cooperate to succeed in today's world. We look forward to maintaining the same secularity for BioYantra 2014 and aspire to have even more participants next year.
We request Mrs. Angeline Krupa, Assistant Professor Senior Grade, Department Biomedical Engineering, to introduce the chief case to all our audience.
Good morning to one and all present here. It gives me immense pleasure to introduce our chief guest, Mr. S. Shankar, Director Customer Care Service, Philips Healthcare India Limited, for our event BioYantra 2013 National Symposium on Medical Devices to grace this occasion. Mr. S. Shankar completed his BE in Electronics and Communication Engineering in the year 19